Hi, my name is Andrea Franklin, and today I will be talking with you about the functional analysis and treatment of disruptive behavior in a Rhesus macaque. Training with animals in a group or room with other animals can be really challenging sometimes, and the trainer can feel like they're in the middle of the classroom that I've pictured here. Other animals can disrupt training by trying to grab the animal that you're working with, trying to grab you. They can be throwing things or just making a lot of noise in general, and all of these can really impede progress when training. So in this study, we had a Rhesus macaque named Kensington, and he had a triangle toy that had some metal and plastic trinkets hanging from it. And whenever I would train with the animals across from him, he would bang this toy really, really loudly against his cage, and it would be very disruptive to our training sessions. Kensington was a 9-year-old male. So in order to understand the reasons why Kensington was ringing his triangle toy, we did a functional analysis. And FA is from the applied behavior analysis literature and is commonly conducted with children with developmental disabilities. It's been used to assess many problem behaviors like self-injury, aggression, disruptive behavior, and noncompliance. FA identifies possible environmental contingencies that reinforce and maintain problem behaviors. And because FA offers insight into why a behavior is occurring, a clinician can tailor a treatment based on its outcome and know what treatments will work and why certain treatments will work. While FA certainly does have its limitations whenever we're working with animals, it has been successfully conducted with chimps, a baboon, lemur, dogs, and cats. And the treatments that were implemented based on the outcomes of these FAs were all successful. Now let's look at what environmental factors, if any, reinforce Kensington's disruptive behavior. In our analysis, we ran 20 sessions that were 5 minutes in duration. We looked at 5 conditions that assessed a different environmental factor, and we filmed all of our sessions for data collection. We defined triangle ringing as Kensington using any part of his body to manipulate his triangle such that it created a sound for at least 3 seconds. Duration of triangle ringing were collected on a tablet using observer software, and a percentage of session with triangle ringing was calculated and compiled in an Excel workbook. The first condition we'll look at is the control condition. And here we're seeing if we give Kensington access to fun stuff to play with, social attention, and we have no set consequences for his triangle ringing, will he still ring his triangle? This condition serves as our baseline condition because we have no set consequences for his triangle ringing. At the beginning of the session, I gave him access to a paper roll, and that was filled with shredded paper and produce. I also gave him social attention for 10 seconds, but then gave him a break from that social attention for 10 seconds. Along with the social attention, I also delivered a treat. However, if he did ring his triangle whenever it was time to deliver social attention or to give him a treat, I inserted a 5-second delay. And the purpose of this delay was to decrease the possibility of him starting to associate in this condition my giving him social attention or a treat when he would ring his triangle. The next condition we'll look at is the alone condition. And in this condition, we're asking if he'll ring his triangle when no one is around. High duration of triangle ringing in this condition would suggest his behavior is automatically reinforced. And an automatically reinforced is a behavior that is maintained by something outside of the social environment. It may be something that satisfies an internal drive. Another possibility in this condition, if we see high duration of triangle ringing, is that it could be possibly reinforced by other animals in the room. In this condition, there were no humans in the room, and Kensington was filmed for the duration of the session. The next condition is the escape from task condition. Here we're asking, is he ringing his triangle because he wants me to go away? High levels of triangle ringing in this condition would suggest that his behavior might be negatively reinforced in the form of a break from me. In this condition, I stood with a tablet in my hand, and I acted as if I were observing him and taking data. And if he rang his triangle for 3 seconds, he received a break from my presence for about 10 seconds, and I went across the room and out of sight. After those 10 seconds were over, I went back to where I was and continued with the mock observation. The next condition is the social attention condition. In this condition, we're asking, is he ringing his triangle to get my attention? High duration of triangle ringing in this condition would suggest that his triangle ringing is positively reinforced by gaining social attention. So in this condition, I stood with my back to Kensington, and whenever he rang his triangle for 3 seconds, I gave him 10 seconds of social attention. The last condition in our FA is the edible condition. Here we're asking, is he ringing his triangle because he wants me to give him something? High duration of triangle ringing in this condition would suggest that his behavior is positively reinforced by gaining access to an edible item. In this condition, I placed a bag of food on top of a chow barrel in front of Kensington, and I stood with my back to him. And if he rang his triangle for 3 seconds, he received a small piece of food. Here are the results of the functional analysis. You won't see any statistical analyses associated with these data. Instead, these data are going to be analyzed by visual inspection. And by that, I mean I'm going to look at the data, and I'm looking for differentiation between the different conditions. I'm also looking to see if there's a high or low level of the targeted behavior in a particular condition, if the targeted behavior is stable or unstable in different conditions, and whether it's trending up or down in each condition. Sessions are on the x-axis, and percent duration of ringing are on the y-axis, and our scale goes from 0 up to 100. A higher level of triangle ringing in a particular condition is indicative that that stimulus could be reinforcing Kensington's triangle ringing. So clearly we see here high levels of triangle ringing here in the edible condition. It's clearly differentiated from all of the other conditions. It's pretty stable, but it's trending a little bit upward toward the end. In all of our other conditions down here, we see pretty low levels of triangle ringing, almost down to 0 levels toward the end of our analysis. And these conditions are not very well differentiated. So these data suggest that Kensington's triangle ringing could be reinforced by gaining access to an edible item. Given the results of our FA, we now want to come up with a treatment that might reduce Kensington's triangle ringing, and we want to use an edible item to do this. We do have some options available to us. We can give him an edible item for engaging in an alternative behavior, or we could give him an edible item for not ringing his triangle for a certain period of time. Another option is to give him free access to an edible item regardless of his behavior. And we started with this because it's pretty easy to implement. We gave him access to a paper roll that contained shredded paper and produce, and we used this for its ease of preparation and cleaning. We then assessed if giving Kensington access to a paper roll will reduce his triangle ringing under controlled conditions. Here are the results of that assessment. All sessions were 5 minutes in duration. Our edible baseline was identical to the edible condition in our FA. And in the paper roll plus ignore condition, I gave Kensington access to a paper roll at the beginning of the session and then ignored all triangle ringing. Sessions are on the x-axis, percent duration of ringing are on the y-axis with a scale that goes from 0 to 100. In our initial baseline, we saw pretty high and stable rates of triangle ringing. After establishing this baseline, we dropped in our treatment, and we saw an immediate decrease in triangle ringing down to pretty much 0% of the session. While it's great that we saw this decrease, we want to know if this decrease is due to our treatment or if it could be due to some other variable. So to determine this, we reversed back to baseline, and we were able to capture what we saw in our initial baseline, which was pretty high levels of triangle ringing that remained pretty stable. We then dropped in treatment again, and again we saw an immediate decrease in his triangle ringing down to pretty much 0% of the session. So this provides some evidence to suggest that our treatment we implemented in a careful, controlled experimental environment is successful in reducing Kensington's triangle ringing. Now that we saw the treatment was successful in a controlled environment, we now want to see if this treatment would be successful when implemented while I was training. Training sessions were filmed and data were collected from these videos. The training sessions ranged from 10 to 15 minutes in length, which was a little bit longer than on our previous assessments. In baseline, I gave Kensington a piece of food at the beginning of the session, when I was about to work with a second pair of animals, and then at the end of the session. If Kensington was ringing his triangle at the time I was to deliver food, I inserted a delay before I delivered the food. All triangle ringing was ignored, and baseline data were collected for a total of 8 sessions. In the treatment condition, I gave him a paper roll at the beginning of the training session and ignored all triangle ringing. Here are the results of our training environment baseline and treatment assessment. Sessions are on the x-axis, percent duration of ringing are on the y-axis, and our scale goes from 0 to 100%. During the initial baseline, Kensington rang his triangle between 20 and 35% of the duration of the training session. We then dropped in treatment, and it dropped down to less than 10% of the session. As in our previous assessment, we want to know if it's our treatment that is causing this decrease in triangle ringing or if it's some other variable. So again, we want to reverse back to baseline. And whenever we did this, we were able to capture what we saw in our initial baseline. When treatment was implemented again, his responding dropped down to near 0 rates. And this suggests that the treatment is successful in reducing Kensington's disruptive behavior when generalized to the training environment. In summary, an FA determined access to an edible item reinforced Kensington's triangle ringing during training sessions with other animals. Based on these results, we were able to implement and generalize a successful treatment to the training environment, and we were able to reduce his triangle ringing by over 90%. A lot of the time when an animal is engaging in disruptive behavior like Kensington's, the toy would have been removed. But rather than removing the toy, FA gave us a much better understanding of what Kensington needs, and because of this, Kensington was able to keep his toys while not engaging in disruptive behavior using a reinforcement-based approach. Our FA indicated why this worked for Kensington. However, because this particular treatment worked for Kensington, it may not work for other animals who engage in similar behavior, and an FA may explain why it doesn't work. For example, an animal may be engaging in disruptive behavior that's reinforced by having a human leave the room. And in those cases, access to an enrichment item may not be that effective. I wish to thank my collaborators, Dr. Allison Martin, Jane Perlman, and Dr. Molly Bloomsmith, and of course, Kensington. Thank you for listening to my talk today.